Thank you very much to Rosario, and now I would like to introduce our second speaker, Natalie Mehra, who is Executive Director and Board Member of the Ontario Health Coalition and has personally led the organization of the Health Coalition in communities across the province as a spokesperson, education, and organizer for the public healthcare movement. Over to Natalie.
Thank you. Thanks for having me. There's a joke that Professor Pat Armstrong uses. She's a professor at York University, phenomenal woman, and she brings both a gender and a class analysis to health policy reform. Can you hear me? People are going like, okay. And so this is hers. So there's a man and he works on a construction site, and every day at the end of his work, he leaves the construction site and with a wheelbarrow, and it's covered in a tarp. And every day his bosses look through the site and they can't find anything missing. And so he does this every day for 2 weeks. He leaves the site, he's got a wheelbarrow, it's covered in a tarp. They search the site top to bottom, cannot find what he's stealing. And so finally they say to him, look, we're not going to call the police, we're not going to do anything to you, but it's driving us crazy. Tell us, what is it that you're stealing every day when you walk off the construction site with your wheelbarrow covered in a tarp? And he says, wheelbarrows. And Pat uses that to underline how privatization is stealing our collective goods and services away from us right under our noses, without most Canadians even realizing what's happening. So in the list of questions that we were supposed to answer, they asked, what is privatization, or something along those lines? What form is it taking? Well, I think this applies to other sectors, but in healthcare, privatization is this. It's the downloading of the cost for care from the collective to the individual. So it's, you no longer pay through your taxes. The biggest transfer, right, of income in the country is the public healthcare system. It transfers about just over $100 billion every year based on income. If you have a progressive tax system, and I think we still nominally sort of do have a progressive tax system. So that money is collected in our taxes, it's transferred back out on free services to people when they need them, right? So it creates ribbons of interconnectedness between provinces, between age groups, between all of the people in society. And so privatization fundamentally is the transfer of the responsibility for paying for care and providing care from the collective back to the individual. It is also the offloading of work from the paid workforce to the voluntary workforce, predominantly women in the home. It is also the transfer of ownership from public and not-for-profit to private and for-profit entities. And it is also the changing of the modalities of work and care from those that are based on compassion and a holistic view of healthcare. I don't want to be too Pollyanna-ish. It wasn't like it was perfect to start off with, but to copy the modalities of the private marketplace. Right? In every hospital you go into in Ontario, they're using the lean methodology, right? Taken from Toyota manufacturing, etc. You see this everywhere. From home care, where care has now been separated into 15, 30, and 1 hour chunks. The workers are required to provide the care within those chunks so that it can be a system that can be bid on by multiple companies, etc. Right? The whole provision of care has changed. The big measures today in the healthcare system are throughput. That is how fast you can move a patient into and out of a hospital. Those number of staff per patient, not from a point of view of trying to ratchet them up, but ratchet them down, and so on. So privatization is a change of costs and responsibilities from the collective to the individual, a transfer of ownership from public and not-for-profit to private and for-profit, and changing modalities of care and work. They asked us also to cover what is the state of privatization. Well, Rosario, I mean, you really said it. The bottom line is that Ontario now collects the least taxes per capita in the country. We fund all of our public services at the lowest rate of any province in Canada. Now, that applies to healthcare as well. We fund our hospitals in particular, which have been the front line of cuts, so obviously the most unionized, the highest paid workforce. Also, where under the Canada Health Act you have the right to access care on equal terms and conditions. Every Canadian has the right to access care. They cannot deny you care. That care has to be provided on equal terms and conditions without financial barrier. That means you cannot be charged a fee for a hospital or physician service or one in a clinic, even when they privatize it. That is the law. And so, of course, they want to move care out from those sectors to sectors where they can charge you out of pocket, where they can privatize the cost, the ownership, and so on. And that's exactly what's happening. So in healthcare, we now fund healthcare near the bottom of the country. We fund our hospitals at the bottom of the country. We've been vying with Quebec for the last few years for the dubious distinction of being at the very bottom of Canada. That's by every reasonable measure. Per capita, that's per person. As a proportion of our provincial GDP, we're second only to Saskatchewan in being the lowest funder of services. As a proportion of provincial revenues, that is tax money coming in, we're the bottom. And as a proportion of provincial program spending, that's what we spend on all public services, we're at the bottom. So this is, obviously it's not just healthcare. Ontarians pay the highest tuitions in the country for university. We pay the most for childcare. We have the longest wait lists for affordable housing. We have, the least stock, I think, of affordable housing in the country. I mean, by every single measure, we're at the bottom of the country. In terms of healthcare privatization, because we've had a large, very active citizens movement, we have not actually, despite the fact that we have the lowest funding in the country, left for our hospitals, and actually the fewest hospital beds left of any province in Canada. And actually, when I measured against the entire OECD, this is just to sort of give you a state of, just a picture of how bad it is. Ontario is at the bottom of the entire OECD. That is all the quote-unquote developed countries of the world. Only 2 countries have fewer hospital beds left than Ontario. That's Mexico and Chile. We are far, 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 far below anyone else. If you measure nursing staff, that's all nurses, RNs, RPNs, regardless of the scope battles within those sectors, we're far below the rest of Canada. 6 hours per weighted case, that's like an average patient, lower than the rest of Canada. All this to say that we have cut the public stock, the public capacity in our hospital system more than anywhere else in Canada. And so all those patients that get offloaded from public hospitals, well, where do they go? Where do they go?
Home care.
Home care? Where else? Nursing homes? Long-term care? So Ontario has not had a wait list for nursing homes in this province, have not numbered less than 20,000 for the entire 16 years that I've been the executive director of the Ontario Health Coalition, and the 5 years before that I was on the board. We're between 20,000 and 30,000 beds short. We have the longest wait lists in Canada by far. The wait lists can be up to 5 years. And people languish without that care. So what do you do if you've been kicked out of a hospital and can't get into a nursing home? What do you do? I mean, if your parent has Alzheimer's, has dementia, you have to take care of them, right? You have to take the time off work or give up your job or find somehow, people look for finding volunteers. People are discharged from hospital into the care of their neighbors. We travel the province asking for stories about what's happening in home care, for example, not covered under the Canada Health Act, right? So as soon as you're discharged from hospital, you're out from under the umbrella of public Medicare, and you have to pay for your own care. There are public subsidies, but the care is ever more steeply rationed every year, and people and all of the suffering that brought about the creation of public Medicare in the first place is being reestablished. We heard from people who are discharged into the care of volunteers, their volunteer neighbor who is 100 years old. These stories are not uncommon. We heard of people commonly being discharged after surgeries with no home care whatsoever. None. With a wound, right into their internal organs. These people would have been in hospital for 2 weeks or more, a decade ago. So massive cuts, massive privatization, mainly in Ontario, through offloading hospital patients into other types of care that aren't covered under the Canada Health Act. But we have fought in every instance the attempts to bring in private clinics, and we've won in virtually every instance. And so in Ontario, it is not like some of the other provinces that actually have cut the public service less, where they have open two-tier healthcare now. In British Columbia, patients are now charged routinely in the private clinics tens of thousands of dollars or more for their surgeries. A hip replacement surgery is $35,000. Even a knee arthroscopy will be $5,000. A woman, Muriel Schoof, she went into a private clinic in BC and she was charged $6,000 for her sinus surgery, which she had already paid for through her taxes, which under the Canada Health Act, she has a right to get without any charge. But the private clinics are billing the public system, like OHIP, and billing patients on top for the same surgery. That is their business model. That's how they make money. And so they're undermining, actually they're completely contravening the Canada Health Act and the notion that people should be given access to healthcare based on need, not on how wealthy you are. So in BC, single-tier healthcare is gone. In Saskatchewan, in November, the Wall government brought in a piece of legislation that will allow them by law to charge for MRIs in private clinics. This is a seriously right-wing government. It replaced the NDP government in Saskatchewan. There is no health coalition active there. Not much of a fight back. That law passed before we didn't even know that it had passed. There was no movement across the country to stop it, unlike when Alberta tried to do it, and we actually stopped the Klein government 3 times when it tried to do that. The Wall government has now, for the first time, I think in Canadian history, brought in, by law, two-tier Medicare. Quebec also in November, on the Couillard government, passed a piece of legislation that will allow them to bring in regulations to bring in two-tier healthcare in an array of private clinics. Couillard quit government, went to the private clinics industry, and then went back to government. So he opened a private clinic himself, and it actually became a big chain. And so across the country, we are teetering now on the brink of losing single-tier Medicare completely. If I don't want to say that it is lost, but in 2 of the largest provinces in Canada, it is lost. Saskatchewan is going very soon. And Alberta and Ontario, they're nibbling around the edges. Here, if you go for cataract surgery, you'll likely be charged for what they call extra eye measurement tests, $100 or $200 for various extra tests. Some clinics are outright violating the Canada Health Act and charging $1,500 for the cataract surgery as well. We go after them all the time. The government cracks down every time we go after them. So, we're in a kind of pitched battle. It's kind of like this. They're over the fence, they're in the yard, and we're, fighting house by house by house, essentially, to try and, protect and shore up the single-tier public health care system. So the core principle at stake in all of this privatization really fundamentally is equity. You lose your public health care system, you lose public education, you lose your public services like hydro, etc., and your society becomes more and more unequal. And so that's the battle that we're fighting. We know that we have the majority of the public on our side, by far, the vast majority of every political party, all voters, doesn't matter the political stripe. When we've run referendums in local communities on the P3s, the public-private partnerships, even in very conservative places like Woodstock, we have overwhelmingly won massive votes to stop the privatization. The issue is not whether or not we have public support. The issue is that unless there's a fight, by default they win. They just keep eating up more and more and more ground. And so for us, the battle over strategy, and I guess I didn't quite understand your point that we just need one Liberal MP. To us, we need, actually, we need far more than that. We need the majority of the legislature, and we also need an active public. But to win, we have to mobilize that support into visible resistance that people like Kathleen Wynne can't just continue to ignore and steamroller over. And I'm almost done. So there was an Elvis Costello song about Margaret Thatcher, Tramp the Dirt Down. It was all about how he wanted to live long enough so when they finally put her in her grave, he could tramp the dirt down. It's a great song. But in the song, he talks about, her sort of being contemptuous of this pitiful discontent. At times I feel that the amount of discontent over what's happening is, it's far too little, that we have not in any way built the kind of public resistance that is going to be commensurate to the threat that we're facing. The Wynne government came in sounding all great and progressive, but this government is to the right of the Harris government in what it's doing. Line them up policy by policy, and what we're seeing is a wholesale revolution in the ownership and control of public assets, of vital public services, and the kind of resistance that we've seen in opposition is paltry. I mean, I think it's fantastic, the votes in municipal councils and so on hydro, but where are the people on the streets? Where is the visible fight? So I'm going to end with this. Our action plan for this spring is this. We're doing a mass survey of seniors, finding out what user fees they're being charged. We're trying to roll back the remaining private clinics in Ontario through that. We'll bring a formal complaint under the Canada Health Act to the federal government. We met with the federal health minister. We are going to pour on the pressure across the country for the new Liberal government to uphold the Canada Health Act. They say that they're interested in doing that, so we'll see if they'll actually do that. We're going to call a referendum across Ontario in April to be voted on in June. We would like it to be a mass referendum. We've done this before, town by town. In places like Hamilton, 300,000 person town, we've gotten votes, 30,000, 38,000 votes I think we got in Hamilton when we did this on the P3 privatization. In that case, we were able to roll back the amount of privatization in the P3s in a way that hasn't been done in any other jurisdiction. We also did this province-wide, but we focused on 5 areas where there were weak Liberal ridings, and we got over 100,000 votes. I think we should be able to get 1 million votes, frankly, and I think designed properly and rolled out properly, I hope we can. But this time it's to stop the hospital cuts. It's 9 years now of hospital cuts. We just have to stop them. So it's a simple question that every Ontarian is going to be on our side. Do you want to see more hospital cuts or not? So we're going to roll out that referendum. That will be in May. And from there, we'll build escalating actions. We know that the budget is coming out next week, so we expect zeros again for hospitals. We expect the same, it's just the same austerity. So we're just going to roll ahead. What's missing, though, is this. TD Economics, basically, in my view, is running the fiscal policy of Ontario completely, from Don Drummond now through to Ed Clark. Why is it that we've allowed this bank, headquartered here in Toronto, to get away with making recommendations like privatizing the ownership of our electricity, forevermore? Why I haven't seen one protest outside there. Why don't we build some kind of mass protests? Why don't we target the state and the bank, TD Economics? Why don't we do something that really challenges, where this is coming from? This stuff is in the interests of TD Economics and the investors, right, who want to make money from hydro at the expense of everybody else. I believe if someone called it, people would come. I certainly would organize towards that. We'll build the most massive referendums we can on the hospital cuts across the province. We're stronger outside of Toronto than in. If people want to work with us on that, we'd be happy to do that. But I think we need to really build up some kind of visible resistance on the hydro front, because if hydro goes, we're going to lose it all. I mean, I just don't see how we'd stop anything from being privatized from then if they get away with this one. Thanks.